So my name's Mcnamee. Oh my gosh, am I 46 years old? I'm 46 years old. I thought I was 45 for a minute, but I'm indeed 46 years old. I was diagnosed with stage 4 pancreatic cancer in 2020 when I was 40. I had a 3-year-old boy and a 9-month-old boy at the time. I was diagnosed in Paris out of the blue, was not feeling sick or tired or ill in any way, and so the diagnosis really came out of the blue. I spent the next 2.5, 3 years in treatment, first doing 9 months of chemotherapy, and then I did 2 medical clinical trials. The first one involved immunotherapy and a PARP inhibitor, and then the second one was a very early stage clinical trial. Both of those were in Memorial Sloan Kettering in New York. My tumors responded to chemo, thankfully, and then responded very well to the immunotherapy and PARP inhibitors. It was during that trial that my tumors were no longer visible on the scans. And then the second medical trial was really meant to consolidate the gains that we made. And that all wrapped up in 2023. Was the end of my treatment. So I have been off treatment and clear of any disease for about 2.5 years now. During that time, about a few weeks after I suppose I was diagnosed, I began writing I began the project which became the book, Everything That Makes Me Happy Makes Me Sad. And it really started out as a series of letters to my sons. Given the survival rates of pancreatic cancer, certainly given the survival rates of stage 4 pancreatic cancer, there was a very high likelihood that I wouldn't be around when they were old enough to make lasting memories of me. And that was terrifying and it was heartbreaking. And in the forever fight for control, I suppose, I wanted to exert some control over my situation. So I began writing this project, a series of letters to them so that they would know who I was when they were old enough to read the book. So I wrote that book really for my sons. I wrote it for my wife. And I wrote it really just to give people a view, as many parts of me as I could possibly put down on paper so that they would know who I was in the event that I was no longer around. And then once it became clear that I was possibly going to survive this, I kept writing and finished it. So I wrote all the way through my last clinical trial, and then I published it well after my last clinical trial when I got it all set and ready to go. And part of the reason for publishing it was, number one, I wanted a physical thing there for my sons and my wife. And number two, I wanted to show that, number one, this could be survived. And number two, that survival isn't always pretty or easy. I think my book has a lot of funny parts to it. It also has a lot of really heavy parts to it, where I struggle through the treatments, which were very difficult. I struggle through just the depth of pain, mental and physical pain that I was in at times. But I also try to focus on the fact that I would try to pick myself up and move forward and keep going. And so really, to me, it was a story of survival, but not a Hollywood story necessarily, really one that shows the difficult parts and the beautiful parts of it. I think right now is a moment of hope. There are the trials going on about the pancreatic cancer vaccine that's being trialed in New York, and I think it's being fabricated in Germany, which is absolutely incredible. There's stories like mine where my cancer responded not just to chemo, but to immunotherapy and the PARP inhibitor, which is absolutely incredible. There are other stories coming out of Spain about incredible results in not yet in humans, but in animals. So right now, to me, for patients, it's hope. For me, it's all the thing I've always tried to tell patients is stay alive, just stay alive, keep going, because help is coming. And at first, I could only use myself as that example of I got that next line of treatment and I'm alive as a result of it. But now you can cite different studies and different modes of progress throughout the world. So for patients, it's hope. And for researchers and funders, it's the same thing. I mean, I'm always amazed, I'm deeply grateful to people who work in this industry and who work specifically on this disease, people who have spent their entire career on what seemed like a hopeless task, like a Sisyphean task, only much more painful in every respect. And now people who've given their lives to research this, to make progress, there is real tangible progress. This is real tangible progress. Me hugging my kids and my wife is real tangible progress. And these next lines of treatment, like we are on the precipice of something incredible. So to patients, I would say keep going. And to those who are working in the industry, I'd first say thank you. And I would second say keep going. You're making incredible progress, and we patients are deeply, deeply grateful.